Dementia is an umbrella term. It describes the variety of symptoms that occur when the brain is affected by certain diseases or conditions. Symptoms of dementia include loss of memory, confusion, and difficulty with speech and understanding. There are many different types of dementia, and some people are diagnosed with more than one. Although dementia predominantly affects older people, it can develop at a younger age. Those with significant learning difficulties, and particularly those with Down syndrome, are at a higher risk of developing dementia earlier on. Dementia is a life-limiting condition, but with the right information and support, it is still possible to live well. A new dementia care pathway for Northern Ireland was developed in 2018 in partnership with people living with dementia and their carers. This animation uses Tom and Jane's story to describe key elements of the dementia care pathway. Dementia affects each person's life differently. Therefore, the support required will vary from person to person.
My name is Jane. My husband Tom has dementia. A few years ago, I noticed Tom was acting out of character, finding it difficult to continue a conversation and becoming easily upset. Tom said it was just his age, but I knew from the dementia health campaigns that dementia is not a normal part of ageing. We made an appointment with Tom's GP. She performed some tests to rule out any physical causes for Tom's symptoms, as other conditions can have similar symptoms to dementia. When the results came back clear, she carried out a short memory test with Tom. She explained that she was concerned Tom might have dementia, but a more specialised memory assessment would be required to make a proper diagnosis. Despite Tom's initial reluctance, we went for the assessment. From that point on, both Tom and I were given the information and support we needed. This included being given information about Tom's particular type of dementia. It was carefully explained to us that although research is ongoing, there is no cure for dementia. However, with medication and the right support, it would still be possible for Tom to live well with his diagnosis. The Dementia Navigator got to know Tom and myself. He could see what was important to Tom. Initially, Tom was able to continue doing many things he'd been doing before his diagnosis, with only a low level of support. As Tom continued through his journey with dementia, we've accessed supports that have enabled Tom to maintain a good level of independence. He's also been able to participate in local community events. These supports have been agreed with Tom. Changes have been made to our home, and Tom has been given a budget to purchase a care package, which means I can take some time out from my caring role. A diagnosis of dementia not only affects the person with the condition, but also the family and carers. I accessed supports that enabled me to stay well and continue caring for Tom. We could both see it as possible to live well with dementia, and that Tom's condition doesn't define him. He is still Tom. Tom has faced new challenges as his dementia has progressed, but he's been shown ways to manage these. I have also accessed training to understand the changes in Tom's behaviour and how I should respond. We understand the importance of planning for Tom's future care and have agreed that I can make decisions in Tom's best interests when he's no longer able to do so. Unfortunately, Tom has had a few admissions to hospital. During one admission, he experienced delirium, but the staff were trained in both delirium and dementia, so they were able to treat his episode. They understood the importance of maintaining as much of Tom's normal routine as possible and allowed me to share in his care. Tom and I have been able to discuss his wishes for his end-of-life care. We have agreed that at the end, if possible, Tom should be at home with his family, receiving comfortable and dignified care. We have been able to record Tom's wishes in an advanced care plan. Doing this has put both our minds at ease, knowing we will be well supported through this final stage.